Welcome to today's presentation, How to be a Proactive Healthcare Consumer. I am Diane Bright. I'm an AARP volunteer. I'm an occupational therapist by profession, and I also sit on the Executive Council of AARP. We're going to go through a few housekeeping items right now. Questions will be answered at the end of the presentation. However, please put your questions in as you think of them throughout the event. We will not be using chat today to list links provided in this presentation for you to copy down. If during the event you have technical issues, we suggest you first try clicking your refresh button. The refresh button is located in the upper left-hand corner of this browser window and looks like an unclosed circle with an arrow on one end. If that doesn't work, try logging out of the event and restarting your computer, then logging back in again. Now, I'd like to introduce our presenter today, Jill Marion. Jill is founder and CEO of Peak Performance Physical Therapy. Jill is board certified licensed physical therapist and a certified orthopedic manual physical therapist. She was appointed by 2 governors to serve on the State Board of Physical Therapy for 8 years and chaired the board for the last 3 years. Jill worked nationally on the Continuing Competence Committee for the Federation of State Boards and was the committee chair for 2 years. Jill assisted in the development of Translatoric Spinal Manipulation. It's a textbook that is currently being used in physical therapy doctoral programs. She has worked as an educator and a clinical resident instructor in the postdoctoral orthopedic manual physical therapy program at Oakland University. She has worked as a clinical instructor for Grand Valley State, Central Michigan University, Wayne State University, Oakland University, and U of M Flint. Jill has developed a residency program here at Peak Performance Physical Therapy with Michigan State University's kinesiology program. Here's Jill.
Welcome. Thank you so much for joining me today. Hopefully everybody can hear me, and we have some clear pictures moving forward here, but I'm really excited to have you all here and to really be able to talk about this topic that is really near and dear to my heart. So how to be a proactive healthcare consumer is something to me of one of the main reasons as to why I started Peak Performance Physical Therapy. Is I'll give you a little bit of my background just so it can resonate a little bit as we move forward through this presentation. When I began in healthcare, I was in the process of in my doctoral program and was working with my grandmother who was suffering from some pain going down her legs and some numbness in her legs. And we had gone from one doctor to another, and we had gotten a diagnosis of sciatica. We have gotten a diagnosis of diabetic neuropathy. We had gotten numerous of different diagnoses, but never any really clear-cut example of what to do and how to treat it and how do we progress forward. We spent more time in doctor's office and less answers than we really needed in regards to move forward. Now fast forward that a little bit. Now that was when I was in school, and we'll fast forward that a little bit into the ability that I've had to work in many different aspects. So as Diane was talking about, I had the opportunity to work in the college setting. I've also had the opportunity to be in the political side of physical therapy and being on the board. But I've been fortunate enough to be able to work on the sidelines with many professional sports teams. And this was something where a light bulb really went off for me in regards to proactive healthcare. And what does this mean? Now, I knew going through this with my grandmother that it was a lengthy process where we would go into one doctor. Oftentimes it was something that we waited for a month or 2 to get into the specialist. They would then order a test, which would then take us, maybe several weeks or a month to get the test. And then we follow up in a month back with the specialist to review the test. And this process was a 6-month process at time, depending on the specialist that we were working with, to try to get some answers, even when we were, really trying to push. Now, when I was on the sideline of some of these games with our professional sports teams, the things that took us oftentimes 6 months happened in minutes, if not hours, on the sidelines of these games. And for me, that was eye-opening. And not that I expect everybody to get instant treatment. That's not feasible. But to be able to wait for 6 months to get a result that I know can happen within days, to me, there's a gap that's happening there. And we really know when we look at the research that the prognosis is substantially different the sooner that you can receive care and the more proactive you can be. So one of the things and one of my initiatives in regards to starting a physical therapy practice is not just physical therapy, but also to be able to scoop up our patients and can really help them maneuver the healthcare system. And so I started at looking at things and policies and processes in the healthcare system and as to why is it that that happens? Why is it that some subset of our population can get care so much quicker and so much more advanced? And their prognosis and their health is overall better. Their longevity and the quality of their life is better, while others really struggle getting into, seeing doctors and understanding their results and getting in to see a physical therapist that is really truly doing education. And why is it that even in my own practice that I was seeing people so far down from the actual injury date? And I'll tell you, it's staggering. The people that we've seen that I thought I could have seen you 4 months ago when this was an acute type of thing and we could have fixed this and we could have moved on very quickly from this. Well, now there's so much compensation and there's so much other things that are highly affecting what we need to treat and how we need to handle it, that it becomes a stacked condition. So to me, being proactive in your healthcare, in any realm, whether it's, from an internist, from it's a physical therapist, from it's getting tests and measures performed, is crucial. It's crucial for your health. It's crucial for the longevity. And it's crucial, really, for you being able to stay as functional as possible for as long as possible. And so, in developing this presentation, I kind of started to think is, what do people want? Are people really happy with their healthcare? Are they fine with this, or are they not? And really, I've been interesting to find out that a lot of people are not really happy with the care that they're receiving or the speed that they're receiving at, but they don't know how to maneuver the system because it's very foreign and at times can be very scary to people. Because when you start talking in terminology like spondylolisthesis and degenerative disc disease and degenerative joint disease and rotator cuff tearing, it's like, holy smokes, like those things are scary terminology if you don't know about it. So you don't even know what you don't know. You don't even know the questions to ask or where to start. And even if you're the most highly educated person, sometimes when you start to get into realm and healthcare, where it's like you feel like a little bit you're at the mercy of the people that are trying to help you, that you just need to take what the advice that they have or the system that's in place. And so I'm here today to talk to you a little bit about how to take control of your own healthcare, how to truly make a difference in your healthcare, and how we can work together as a healthcare team with our patients to assure that we are really hitting the mark that we need to make. Because ultimately, we want everybody to be healthy and we want everybody to be functional. And the more that we can do that, the better off we are, and the better off we're going to be from a cost standpoint, from a functional standpoint, and from a societal standpoint. So to me, that's just crucial. So just to update you a little bit, throughout this presentation, like Diane said, we're going to be doing some poll questions. After this slide, we'll start with those poll questions, but I think those are really, they're going to be really good to start to get engaged. But before that, like I said, I really reached out to see kind of what do people want. What I found is that everybody wants the best medical care possible. But that involves more than just picking up the phone and calling and making an appointment and saying, I'd like a doctor visit, right? So when you talk to people and you say, what kind of care do you want? Well, I want the kind of care that Tom Brady has, right? I want the kind of care that, those people that are on TV every Sunday are getting, because we know that it takes them minutes, hours to go through what we would typically have to go through some arduous process, right? I think there's not anybody that I've talked to that's not like, heck yeah, I would really like that. I want my team to be on board with me. I want my team actively thinking about me after I leave the office, and not just an in and out type of thing that just to kind of push me through. So a proactive patient is an informed patient who finds a good healthcare team in a medical facility prior to. So a proactive patient, and we'll talk a little bit about that as we move forward, is what are the things that you can do as a proactive standpoint, as opposed to, here you are in the back of an ambulance heading to the hospital because there's been an event that has gone on, that now you're at the mercy of what you're going to get when you show up in the emergency room, right? How proactive can you be? Wouldn't it feel good to go in and be, hey, I already have a team. They may not be on call, but they would be willing to talk to the on-call doctor, and they know my case already. That would make you feel much better than already being in a scary situation with unknown care and unknown quality and unknown service as you move forward. So some of the other characteristics that I've seen of people that do this right, that do it good, is they do independent research using reliable sources and asking detailed, relevant questions. So ultimately, each one of us is in charge of our own health. So, how do we do this? How do we really move forward and find out, what the right questions are and where the right questions may lie? And so that's the key. And if you don't know what you don't know, it's hard to come up with questions. So we're going to talk a little bit about that. The following, as we go through this presentation, are some of these proactive tips. And I hope that you leave today with a really good understanding and maybe a few takeaways that you can start tomorrow to really be able to change the way that you see yourself in the whole healthcare field as a consumer, and where you stand and how important your health really is. So we're going to start with our first poll question, and we'll transition from there.
I need to let you guys know that are watching that you'll answer your poll questions we answer the poll question on the screen, but if you have other questions, you'll use the question and answer site to do that, and you'll see that at the bottom of your screen if you move your cursor down there. So our first poll question is, how long have you had to wait for an appointment with a healthcare provider? It's multiple choice. You'll just click on one of the bubbles next to the choices. Less than a week, 2 to 3 times a week, 1 to 2 months, more than 2 months. Okay, we've got some results here. Did you want to see the results, Jill, or you want me to go through them?
No, I see them. That's fine. I can go through those. So looking at this is really, thank you for participating. This is an exciting way to be able to do a presentation. So I really appreciate you guys getting involved and being active, because I want this to be something that we can make as custom as possible as we move forward. So when we look at this in regards to having to wait for a healthcare provider or an appointment, the majority of people are waiting 1 to 2 months to get in. 67% of you that voted are waiting at least 1 to 2 months to get in. And so one of the things that we talk about with that is that when you have to wait that long, it decreases your overall prognosis. It decreases your ability, if you're truly going in to see a practitioner for something that's going on at that time. 1 to 2 months, when you start getting into 2 months, that starts getting into chronicity, or a chronic type of condition, as opposed to acute condition, which is more something that's treated right away. And what happens with that is that it takes longer to recover because your body has gone into an adaptation phase. So that is, you know, something just to think about, as well as the fact that I told you that we know that oftentimes if you're waiting 1 to 2 months, we know there's potential for you really to be able to get in that same week, okay, within the system. Now, there we go. Okay, so we know that, you know, because it takes people so long to get into their practitioner, that oftentimes you become a Google doctor, right? So people, what do they start doing? Like, man, I need help right now, but I can't get help. 67% of you think that you can't get help for 2 months. Well, we're not just gonna sit around and not do anything for 2 months, right? We're gonna look on every aspect that we can to truly find out what's happening. What can I do in the meantime? How can I find out information? What could this be, right? And that's fabulous, and I would encourage you to keep doing that. However, we look at a recent study that stated over 70% of consumers have looked online for healthcare advice. So if you look at these numbers, these really, the interpretation of today, all of you that have voted on our last poll question, that is about average. It's around 65 to 72% of people that are waiting at least 2 months to get into a practitioner. And so when this 70% number falls right in line with that, because if you're gonna wait that long, what are you gonna do? You're gonna go online and look for your healthcare advice to see if you could do something in the meantime, right? So I went in and I did a review of 79 studies that were published in the American Medical Association. But in reviewing that, the conclusion was that online medical information is frequently flawed, inaccurate, and biased, depending on who's paying for the study, depending on what the outcomes were, depending on what type of statistical analysis they did on the research. And that makes it extremely confusing for, you know, a consumer out there, because every time you turn around, right, you know, dairy is good for you. No, dairy is not good for you. Eggs are good for you. No, today they're not good for you. You know, and that's frustrating and can be confusing to the consumer. Same thing when it comes to, you know, healthcare. It depends on the statistics, it depends on the analysis and the actual content. So that's extremely important to know. So you really want to, within your community, talk to people that have firsthand experience. So it's imperative that you're talking to people on the front line. Talk to your nurses, talk to your occupational therapists, talk to your physical therapists, talk to your ultrasound technicians and your, you know, your radiology technicians, some of those individuals in your community. Talk to them and just start. That's the first starting point, is just start to ask them a little bit about, hey, if I had diabetes, who would be the best person? Do you know? And, you know, if I fractured something, if I fell and fractured something, who's the best in town to handle fractures? You know, if I was going for physical therapy, where would be the best place? Who do you recommend? And doing that now to be proactive is extremely important. So some sites that are helpful to look at that we have vetted, so with the American Medical Association, the American Physical Therapy Association, and the Michigan Physical Therapy Association, is a requirement on all 4 of these sites that I have up here, that some sites are helpful, that the information that's posted has to be unbiased and on basis of financial backing. And so that's extremely important when you're looking at some research and some sites and some different places to go to find good information in regards to care. Also, it will give you some feedback a little bit on maybe some places that you can go that oftentimes if you think, you know, maybe I need to get into my physician, like I really hurt my back. I need to get in my primary care doctor, but I can't get in for a month. Well, in the state of Michigan, you can get into your physical therapist direct access, and actually they are specialists in musculoskeletal care. And so oftentimes you may get a more thorough evaluation in that realm of getting in with your physical therapist that you may be able to get in right away or within the week. Now, if you're having some kidney dysfunctions or different things like that, that might be something that you need to get in with your primary care physician, or maybe you need to get in with the nephrologist, or something like that. But truly understanding who does what and who's the specialist in the area is crucial as we move forward. So we're going to look at being proactive and getting things accomplished. So today we're going to talk a little bit about your doctor visit. Okay, when you go into a doctor, or any healthcare professional for that matter, your physical therapist, your OT, your speech therapist, anybody that you've seen, if you need to get tests set up, attempt to do it before you leave the office. That's crucial. Oftentimes you'll go in for a visit and they'll say, okay, yep, we need to get an x-ray for this, or maybe we need to get an MRI, or we need to get a CT scan, we need to get some blood work. Our office will call you and will follow up to get that scheduled. This is one of the first breaks in the chain that I see with our patients that we deal with, is that oftentimes this just doesn't happen. There's a miscommunication, there's a misfiring that happens. So really what needs to happen here is several different things. So the doctor's office needs to call to get the tests ordered. The test, where they're ordering it, they need to take it, they need to get your information, and then they need to follow through and call you. Okay? That's a multi-step process that if you have it done in the office before you leave, it's crucial. So they'll say, nope, our office will call you, we'll handle that. What you would say is, nope, that's fine. I'll just wait, and we can call right now and get it scheduled because I have my calendar with me, and we can get that taken care of. That now skips a 3-step process and making it into a 1-step process, and becomes extremely efficient. Now you know when your test is, and you're still sitting in the office. So now you say, okay, my MRI is scheduled for Wednesday. Perfect. It takes about 2 days to read and get the results back. So I would like to follow up back with you on Monday to review my results. Now you've just taken a potential 1 to 2 month process and condensed that down into a week and a half, which is crucial. It's crucial for your health, and it's crucial for the overall prognosis of what's going on. So you can do that right then and there, as opposed to waiting for them to call the facility to call you to get it scheduled, then you to call back your doctor's office to get an appointment. So you can see how small little changes, and you don't have to be rude about it, and I understand every office is different and every office is busy, but that is not an unrealistic expectation that you get that scheduled at that time. So if you can't do it before you leave the office, because sometimes they'll just say, absolutely can't, right? We can't do it before I can't leave it. Where right now the scheduler is so busy. Schedule a time for them to call you so that you are prepared to get it scheduled right then. So that's perfect. If you can't do it, I would be diligent to make sure that you can get it happen. But if there's some reason that you can't, definitely give them a deadline as far as when to call you, when your expectation is that you would like to have it done by. That is crucial. And like we talked about, schedule a follow-up to review your results at the time of your appointment when you're there. A reasonable follow-up after you have your test results are about a week and a half. So if an MRI, an X-ray pretty much can be read right away. An MRI takes a couple days for the radiologist to read it, for it to get into the system and back to your physician with the portals, depending on what portals they're using. Some other tests are a little bit more comprehensive, like blood work testing, and sometimes they need to actually run and they need to sit for a little bit. But a reasonable expectation is about a week and a half, not a month, not 2 months. So even if you can't get your appointment scheduled, a reasonable follow-up is going to be a week and a half after you get your tests. So that would be something that you should try to do while you're in the office, so you're not getting any lag time there. So we're going to transition now on to the next poll question.
Okay. The next poll question is, I'm extremely satisfied with my health care and feel that all my needs are being met. Another multiple choice, do you agree, somewhat disagree, or disagree? And while you're doing that, just a little note that the resources that Jill had in her slide about getting your information from the internet is available in the chat room if you need to take another look at it. There we go.
Good. So that's good, right? When we look at the numbers, so 8% agree, 69% somewhat agree, 15% somewhat disagree, and 8% disagree. So I'll tell you that's a little high, and that's good. I'm glad, and you guys obviously are all healthcare consumers that are a little bit more proactive, so that's wonderful. Either that or maybe your expectations are a little bit lower. But most likely you guys are in great hands with great providers. So that's really good that somewhat agree that you're healthcare practitioners and that you're really happy with the healthcare that you're receiving. So what we really want to slides just don't want to advance. So what we really want to talk about in regards to how can you make your healthcare a little bit, tighter, a little bit better in regards to, if you're really happy, great. How can everybody strongly agree that the healthcare that they have and the team that they have is fabulous, right? That is something that's, I think, really important. So what does that look like? And so what I've done is I polled and talked to many people that I feel have done a phenomenal job in developing their healthcare team, that have a team working for them, and that are getting significant healthcare results. And some of the behaviors that we've talked about are listed on here. So be prepared with questions you would like answered before you go in. And so when you think about this, and I want you to think about this as somebody that you would hire at your house to do something, right? Whether it's maybe somebody to come in and cut your grass, okay? So somebody to come to your house and cut your grass. If you hired somebody to do that and you were gonna pay them, say $150 for 15 minutes, what would your expectation be of that person? Right? So think about that a little bit, because that's exactly what's happening as you're going in to this doctor visit. Now, you may not see the financial exchange, but I'm telling you that it's there. And it's there through insurances. And it's there because you are paying for an expertise of somebody that spent a tremendous amount of time on their education to get it. But oftentimes we lose track of that. Because to think about it, if we were hiring somebody to come in and do something around our house and pay them $150 for 15 minutes of our time, our expectations might be a little bit different. We might have a little higher expectations of the results and the type of communication that we're having. So prior to going into your visit, you want to prepare. And oftentimes the questions that I get are that, oh, they were so busy and I felt bad, like I didn't want to hold them up. Okay, think about that again. Would you treat the same person that you have coming into your house to help you out, paying them $150? Would you feel bad about holding them up to do their task, to ask them questions, to really help you move forward, right? So that's something that's it's crucial to get that in order and to make sure that you're on point with that. So be prepared with the questions that you would like answered on your healthcare before you even come to your appointment. And so that means you can write them down, you can type them up, you can have them in your head. What I found is to actually have something written out. So as you come in, you look more prepared. And so it kind of is like, whoa, this person's kind of got their wits about them. The healthcare professionals is, maybe going to take you a little bit more seriously as you come in and sit down with your specific questions that you have ahead of time. And assure that you get them answered before you leave. at the beginning of your visit, your goal needs to be stated. So let the healthcare professional know at the beginning of your appointment what the goal is for your appointment. So think of this almost as a business meeting. And one of the most business meetings that the biggest, most important business meeting that you can have, because it's about your health. It's about how long you can live and how the quality of life that you can live. So as you come into, the visit, it's, hi, Dr. Smith, I'm very happy to see you today. I have a list of questions that I'd like to have covered, but today my main goal is to be able to review my diabetes and ensure that all of my medications are on point and I'm taking the correct dosages. I would like this handled and answered before our appointment today, right? So that you're extremely clear on your expectations of the appointment and what you expect throughout that visit that day. Because oftentimes what I found is that people go to doctor's appointments and it gets off track a little bit. And then they leave and they're like, oh man, I don't know. I didn't get that question answered. And I'll ask them, well, what level did they operate on from this report that looks like different than what you're telling? Oh, I don't know. We didn't have time to get to that, right? So be really clear in your mind when you leave on what exactly the goal of your appointment is, and that you have your question list and that you let them know that you have 5 questions. Be reasonable. We want to be respectful of their time. You don't want to come in with 25 questions, but you do want to have a subset of questions that you really need answered, that your expectation is that you should get them answered. So assure that you get all your questions answered in the terms you understand. One of my big things I tell a lot of people that I work with, a lot of my patients, a lot of people in the community, is ask the next 3 questions, right? And people are oftentimes afraid to ask because they think that they will be stupid. They're like, oh, I don't want to be the dumb one. Like, I don't know. But if you leave a doctor's office and you don't understand or you don't comprehend what is going on with your test results or truly what is going on, that is a significant drawback for your ability to really make a difference in regards to your care. You need to understand what's going on. There's nothing more important than that. So if I explained something to you and said, Mr. Johnson, you have degenerative disc disease, you have a spondylolisthesis, and there's a chance that you may have some neuropathy in distal extremity, right? Like, what the heck is that, right? Like, what does that mean? And that sounds really scary. Like, all those things sounds like, am I gonna die? Like, what is happening, right? So what that means is that you may have a little bit of arthritis in your back that's causing some bone spurring, which is potentially some arthritis in your back, that might be irritating a nerve that could be causing a little bit of numbness in your leg. Now, that sounds a little bit better, right? Like, that makes sense to me. Now, if you know what's going on and it makes sense to you, your ability to self-help yourself and to self-treat significantly higher. And so it is crucial that you understand. So if you don't understand the terminology, keep asking until you understand. And it's not, unrealistic for you to say, could you please explain that a little bit more clear? Or could you help me understand? Or I'm not really sure, like, what are normal blood levels? Like, what does this mean for me? Those are really good follow-up questions. But if you really don't understand, don't let somebody talk over your head for you to leave that appointment unsure of what's going on. So that's extremely important. So those follow-up questions are crucial. When we look at, kind of that's what your visit should look like when you go there. But even prior to that, developing relationships with your healthcare professionals is key. That is something that is make or break. Developed prior to need. So I said the worst case scenario is you're in the back of the ambulance and you're heading to, wherever, and you're trying to find a doctor and you're in a crisis. You never want to be in that situation. So now's the time to just do a little bit of research in your community. When you go in and you talk to your, people that you trust now, your providers that you trust now, whether it's your primary care, your physical therapist, your OT, people in your community, start asking. It's crucial. So the people that I know that do this the best, they have individuals before their issue, which means they have a primary care doctor that's proactive in their care. They potentially, maybe even at a young age, have had interaction with the cardiologist and just a preventative screen or a preventative visit. Once you've established that relationship, you now have a good relationship with this person that you can get into in a state of crisis, and they have a good baseline on your situation. They have a good musculoskeletal person, so a good physical therapist or OT that they've worked with to be able to help them through different scenarios throughout their lifetime. We're not going to get through unscathed. Nobody does. And so if you have those type of people in place, that really helps. They have people that they know from a surgical standpoint, from an orthopedic surgery standpoint, and they understand the results of those surgeons. And now oftentimes one of the things that I hear all the time is that, oh, I've heard that she is not a very nice doctor. Like her bedside manner is horrible. But you know what? I don't really care as long as she's a great surgeon. Right? And maybe you listening have said that. Maybe you've heard your friends say that. Maybe you've heard somebody else say that. But I'm here to tell you that there's enough phenomenal surgeons in the area, in the country, in our state, that is not acceptable. Because even the best of the best, and I've had the opportunity to work with some of the best orthopedic surgeons in the world, they sometimes make a mistake. And so if you happen to be that person where, not even a mistake, it's just maybe not the best outcome, right? You need someone that has a good bedside manner because you're going to need their help. You're going to need their help to work through this condition. And your relationship with your doctor in scenarios like that is crucial. It's just crucial in regards to how well you get and how soon you recover from potential and what your options are. So there's enough good surgeons there that have phenomenal bedside manner and do a phenomenal job in surgery, whether it's an internist, a general surgeon, whether it's an orthopod, a cardiac surgeon. They're out there. And so if you can just make sure that you're finding those people before you're in the crisis situation, it's crucial. And so, the other thing that I talk about is really listen to your gut. So that to me is, a lot of times when patients come in, they know what's going on. And they've been to many different practitioners and have said, I just feel like this is happening. It's like, no, none of your test results, nothing is, nothing's following up with that. And nothing's pointing towards that. It doesn't seem like that's what it is. But in your gut, you're feeling like it is. Now, sometimes people are wrong. Sometimes physicians are wrong. Sometimes PTs are wrong. But truly, you live with your body day in and day out. And you know if there's something not quite right. So I'm going to tell you a little story about, kind of an individual that came in to see me. But before I do that, I want to get into a poll question. Let's do this poll question, and then I will transition into the story because I think it's really fabulous, and I'll be able to kind of, based on your results, talk a little bit more in depth.
Okay. Here's our next poll question. I know how to find a healthcare team I need. I agree with that, mostly agree, somewhat agree, or disagree. Also, while you're filling that out, I do want to remind people that if you do have a question, you want to go to the bottom of your screen and click on question and answer and type that question in so we have them ready when we're at the end of the presentation.
Good. All right. So I know how to find the healthcare team I need. So 31% agree, 50% mostly agree, 13% somewhat agree, and 6% disagree. So in looking at that, for those 6%, those are, feel free to put some questions down there that you have for the end. I'd be happy to discuss that on what are some of the tricks and different things there. But for the 31% that agree, that's fabulous. Make sure that you're doing it proactively as well, because that's crucial, is we just really want to make sure that you're doing that on a proactive standpoint right now. One thing that you can look at right now is your family history. So what are some of the things in your family history that maybe your parents have or your siblings have, or maybe something that runs in your family is high blood pressure. And so, who is it that you should be looking at right now, even though they're saying you're just fine, that's fine, but everybody else and all your siblings really, had to be on high blood pressure medication and those kind of things. So it's really important to be proactive. Make sure that you understand what could happen. What are the potentials that could happen down the road? And do I have somebody on my team right now that I can utilize for that care, or somebody that I can reach out with, that I can have access to within a week to be able to help me solve my issues? And I think that's crucial. So as we look at developing the healthcare team, what I've seen with my different patients that have come in and different individuals that I've helped kind of consulting with is that as they're developing their team, they're like, sure, I'm really healthy. All I really need on my team right now is a primary care doctor, and I see them maybe, once a year, and it's really not that big of a deal. And so I don't really need a team right now because I don't need it. So I can't stress enough the proactivity and how important that is as we're moving forward. But as we look at, kind of listen to your gut, we were talking a little bit about that. To me, that's crucial. And I've seen it time in and time out in regards to people coming in and patients coming in. So I told you I'd tell you a little story about an individual that I had saw now probably about 12 years ago at my practice. And he was an individual that, obviously it was 12 years ago, so I still remember it because it was just so critical on missteps of what had happened. So he came in to me, and he was an individual that kept on getting really dizzy. He was in a car accident, and he was in a car accident about 3.5 months prior to coming in to see me as a physical therapist. And he was complaining of dizziness, and he was complaining of, at times he would get lightheaded, and he had fainted a couple times over the last 3 months. And we went in right, when he came in, and I said, after the car accident, what happened? Well, I went into the emergency room and I had a full workup. So I had an x-ray, I had an MRI. I said, okay, can I look at the findings of those? And I looked at the findings, and it showed, the MRI showed that he was in a whiplash type of injury and that he had some swelling and some blood in the tissues behind his neck. X-rays came back negative, and really the MRI came back negative. And so he consistently had these symptoms. He had followed back up with his doctor now on 3 different occasions, had seen a specialist, and had another MRI done because he fainted, and he had an MRI done of his brain at that time. All of these came back negative. So I had gotten all of the information, got all of the tests that were negative, and I called and talked to his doctor. At this point, he was seeing a pain specialist because he was still in quite a bit of pain and still getting a lot of dizziness. And at this point now, at about 4 months, he was no longer able to work. He was a salesman. And so I started doing an evaluation on his cervical spine and his on his neck. And on his neck, he felt like he was very loose to me on his upper neck. So I called his doctor and I said, I think we need to have an x-ray, not just a straight plain x-ray front to back, side to side. We need an x-ray that will show whether his bone is being held up against the front of his vertebra at C1 and C2, the top two vertebrae. Okay, and the doctor's like, we've done everything of testing. Like, I think he just might be, you know, still recovering from a whiplash. And I'm like, let's just, you know, just humor me, let's just try it. So we sent him in for an x-ray. And when you do this x-ray, in order to see that, they have to take it through your mouth. So you have to have your mouth open. It's an open mouth x-ray because your C1 and C2 is right behind your molars on your teeth to be able to see it. So he went in and he got this x-ray. And 2 days later, I got the report of the x-ray, and the report of the x-ray said negative. And it said negative, all findings normal, appears to be no fracture. And so I read the result and I was like, okay, everything else was negative. I called the doctor to see if he had gotten the test results, and he said, yep, it's like, it's negative, everything's coming back negative, everything is fine. Now the patient this time, when we talk about listen to your gut, the whole time he's telling me something's not right, something's not okay here. And so what happened in this case is I said, I want to see the films. So I had the patient go and get me the films. He went in, he got me the films and brought them back, and they took the x-ray with his mouth closed. Okay, so you couldn't see what we were trying to look at. I was trying to see if the bone was unstable, and by the x-ray, you couldn't see that. But of course, the x-ray was negative because you couldn't even see the bone that I was trying to look at. So I called the radiologist and I said, I was hoping to have had an open mouth x-ray. Do you think that we can tell if this ligament had been torn with the x-ray that was provided here? And he said, no, absolutely not. So I called the doctor and I said, did you order it like this? And he said, yes, I did, but they didn't do it like that. So the doctor ordered it correctly. It was done incorrectly and given a negative result. So I said, well, I reviewed the test and it wasn't done like you ordered it, but it is negative based on what they did. We sent the patient back to have the open mouth x-ray the next day. So he went back and got it the next day. They called the patient 2 hours after he had the x-ray and said that he had a full ligament rupture and that his bone potentially was coming away from there, that he needed to go in immediately and have a cervical fusion to his neck so that he wasn't paralyzed. And now, obviously, this is an extreme case. And so when we look at, but it highlights many different aspects that the patient kept telling me that something wasn't right here. All the tests in the world had been done and all came back negative. But nobody circled back to see if in fact the right tests were done and if the negative meant that in fact there was nothing wrong, or just the fact that that test maybe was done either incorrectly or at the wrong angle or something like that. So it's just crucial to make sure that you follow your gut. Like, I just think, and I've seen things on not so much of that, that scale, but time after time after time. Again, physicians are human, and the reports that are getting run from your results, so your MRI reports, you can always ask a different radiologist to read that. And I've done that several times and on several different occasions. And you'd be surprised, the same pictures, the same image, a different report comes back on a different finding. I had a patient last week that came to me that had a lumbar MRI that came in, that they were told her that she needed to go in and get an MRA because an incidental finding in her lumbar MRI showed that she had an aneurysm in her aorta, lower in her stomach. She went in and got that. That came back completely negative in regards to that. So I took both of those results and had them sent to somebody else for them to read both of the tests and read the results. Come to find out, completely negative. It was an incidental bubble finding on the MRI and no aneurysm is present. So follow-up is key. Follow your gut is crucial. It's just extremely important as you move through. See here. Oopsie. Uh-oh, I just back. Here we go. Okay. So lastly, we want to seek out and use the best practitioners. Don't let proximity be your criteria. Now, for some things where you're going on a regular basis, like your, primary care physician or something like that, that may make a little bit more sense. But it might make more sense for you to drive maybe 10 more minutes to get to somebody that truly is going to make a difference in your care. So really make sure that you're talking to knowledgeable healthcare providers to get advice. Like, that's crucial. You want to make sure, as if, people treat their cars sometimes better than their bodies, where, you're going to look all over the state for what's the best car, for the best deal, for the, the best thing that I can get for the best price. And for our, our own bodies, our own healthcare, we're like, sure, we'll just, this is fine. This is good enough is good enough. Well, I'm here to tell you that it's not good enough, that it's a really big deal that we're healthy and that we stay healthy and that we have the right people on board. So really think proactively. Right now, think about the potential for injury, think about the potential for, any kind of health concerns that could come up in your life right now, and be thinking about the opportunities of being engaged with healthcare providers now before you need them, of your potentials. And so you can be interviewing them as they come in. In your first visit, you should interview your practitioner. That's important. It has to be a fit for you and them. So you are not at their mercy, because really we're paying the healthcare providers. When my patients come in to see me, they are paying me to help them. It's not the other way around. And so, my job is to work for each and every person that comes in to see me. And that's how healthcare should be. That should be across the board. You shouldn't feel like you're at mercy of your healthcare provider. So the more proactive you can be, the better you can be in the long run for you, because you can pick and choose who you want to work with. So in time of crisis, you can be extremely efficient and effective with your healthcare. And then lastly, I would say that, use practitioners like we've talked about before that you're comfortable talking with. You have to be comfortable talking with your practitioners. You have to be comfortable sharing things, and you have to share information truthful. One of the things that we talked to a lot of people is like, oh, I didn't want to tell my doctor that I didn't take that medication for the last 2 months because they're going to be mad at me. You need to tell them. You need to be truthful. This is a place, where there can't be any hidden secrets, because they can't help you to the best of their ability if you're not honest and forthright and that you're not doing your part. And so you have to feel comfortable. If for some reason you're not maybe telling the full truth to your doctor, you might not be going to the right physician. So think about that. If you're not comfortable in telling them, maybe I'm not taking my medication, or maybe I'm not doing what we talked about that we agreed on that I thought I would do, changing my diet, exercising more, whatever it is, then maybe you're not comfortable enough talking with that person. And it might be something that you look at, why is that? Your job is not to impress the doctor. Your job is to be healthy. And that's crucial as you go in there. So when you're looking at your overall experience, I would urge you to think of your physician appointments, your PT appointments, your OT, your speech, any healthcare appointments that you may have, your specialist appointments, as a business visit, as a transaction that you're working through to make sure that you're getting the best results. Come prepared. Come prepared with questions. Come prepared with expectations in regards to the financial exchange that you're giving in return for that, with realistic expectations of your providers. Be extremely proactive. Be very knowledgeable about the good and the bad in the healthcare realm within your facility and your community. And then I'll make sure that you're really comfortable with the individuals that you have on your team, that you can talk to them, you can be forthright, you can be truthful, and that you're working in the same range. So using these techniques are some of the techniques that I've seen that I've worked through with professional athletes, with CEOs, with individuals in our community who really make sure that their healthcare is extremely important, and that they're really making sure that they're staying proactive with it. If your life and your job depended on your health, you may think of it a little bit different, right? So our lives do depend on our health, but oftentimes we don't make it a priority until it's already too late. So I want to make sure that you leave this being extremely proactive. It's a perfect time in January. It's that new you, that new year, to really kind of jumpstart your healthcare, your health initiatives, and your overall expectations of yourself and your healthcare team as we move forward. So thank you so much for listening. I really appreciate it. And I'm happy to answer any questions that you may have as we move forward.
Well, thank you, Jill. Thanks for that wonderful presentation. We do have some questions. One of the first ones that came through is, what if I'd like another test, but I don't know what that test would be?
Yeah, and that's a really common question. So oftentimes, it might not be a test that you're seeking out. So the question that I would always ask somebody that's saying, like, people that are usually asking for other tests are people that are not getting resolution to their answers. So, in that instance, it's like, okay, I may want, I had an MRI, but it came back negative, but I know there's something still going on. So instead of asking for another specific test, the next 3 questions to ask are, could this be something else? What is it? What would be a differential diagnosis to the symptoms that I'm having that could be there that is not showing up on this test? Right? And this will start to prompt your doctors to think out there of like, oh, you know what? There is an MRI we could order that will actually see your arteries instead of just the, or maybe we need an EMG instead of an MRI because it's a nerve thing. But you help prompt them to start thinking kind of like, okay, what else could it be? How else could that be? And so if you're not quite sure what test to ask for or what the next thing is, typically, like I said, I see it's that you're searching for something that you're not getting. Your test may be coming back negative, or start asking those questions of your physician. Ask those next 3 questions of them. Could this be something else? What else could it be with these 3 symptoms? What are some other things that you may be thinking of? And then they say, okay, well, it could be a nerve condition. So tell me what kind of tests and measures you would do to see if it's a nerve condition. And start following up like that, because then you're going to get the answers of maybe a plethora of things that are out there, some opportunities that you could do. Are there any other ways that we can treat this? What, those kind of things would be the follow-up questions that I would have that are going to give you a list of potential tests and, potential treatments, measures that you can really get.
Thanks, Jill. Some other questions that came in kind of meld together, so I'm going to kind of put them all in one little ball here. Christopher had asked, when looking for healthcare help, does it help to ask people for referrals? And some other questions that came in would be, is it best to ask for get your referral via word of mouth, people that you know?
Yeah, and that's crucial. And so typically, the closest people to you know you. And so they'll know what kind of provider you need. Sometimes you'll talk to somebody and you'll say, they'll come and say, oh my gosh, they were the best person. They were the best surgeon ever. Well, maybe that person only wanted somebody that, was very abrupt and very to the point and didn't want discussion, but maybe they hit it off really well. Well, that might not be your person, right? So typically, my recommendation when you're looking to develop your healthcare team is start by the closest people proximity to you. Hey, do you have a family doctor? Who do you use? Do you really like them? Like, tell me a little bit about what your visit looks like. So, is it quick? Do you get back on time? Are you, in and out, or do they actually sit and take the time with you? Those are some questions that you can start to ask them. Well, that sounds like somebody that I'd like. And then oftentimes, if it's a primary care physician, you'll call and they won't be accepting new patients. So how do you maneuver that system? You now go to that person that you just talked to and said, you referred me to see this person. They are not accepting new patients. Can you put a call in for me and ask if they will accept me as a new patient because you referred me? So you have to work the system a little bit in regards to, how you can get in and how you can maneuver, because a lot of the primary care physicians, if you're looking to switch, will tell you they're just not accepting new patients. And I'm here to tell you, we work with our patients that come in here all the time, and we're able to get them in with some really good primary care docs that if you just called their office would tell you they're no longer accepting new patients.
Great answer, Jill. Another ones that kind of meld together here, but I'll give them to you a little separately. Is it sometimes good to have another person with you at a results appointment or an initial appointment so that you heard everything or are sure that you have heard what was reported?
Yeah, and I think that's extremely important, and especially if it's a test result that potentially there might not be good news. So the research actually that shows that if you're going in for a test result, and you know, maybe it's even just an MRI, and you're thinking, this may not be great, this may not be the best news. After a physician gives somebody the results of a test result that to them might be damaging or devastating, typically 15 minutes after the results are given, patients cannot recall the conversation. And there's been a ton of research on this in regards to different conversations and truly what are people comprehending after they've been given news. And so, and it doesn't have to be something drastic like a cancer diagnosis. It could be that you have a herniated disc in your low back, or it could be that you have nerve damage in your leg, and everybody takes these a little differently. The conversation, how people recall it and how the physician recalled it are completely different. Same thing post-operatively. So oftentimes when you've been under anesthesia, you will come out and present as if you are completely with it and completely cognizant of the conversations and the things that you're having with the physician, which in fact is not the case. You will have no recollection of even talking with the physician at many times, is what I find. And so it's imperative that you have somebody there to be able to take notes, to be able to advocate for you, and to be able to help you through the situation so that the conversation is congruent between really what happened and what was said.
On the to back up with that, another question is, what about recording your appointments and especially a result appointment? Is that okay?
Yeah, so that would be, that to me is always, that has to be a comfortability level with your provider and, yourself as you're going into the appointment. Now, it's not that you can't do that, but I would say that you never want to record a visit that they specifically don't know that you're doing it. I just think from a professional standpoint, it's important that you just say, hey, listen, so I can go back and truly maybe understand this or have questions later, I'd love to just record this in our conversation. I would say 9 out of 10 people have no problem with that whatsoever. And I think that's a good thing. Then you can go back and review that. But I wouldn't do it just sneakily or, record it and go back without them knowing, because I think that you want to make sure that everything that happens is extremely at the highest level of trust between the physician and the patient. And so you don't want to do anything to breach that. But again, if they are not comfortable with you recording something, that might be a small red flag to you that maybe it's not all on the up and up, type of thing, because really the goal should be of the visit that the patient gets the best out of it.
Good idea. Great. One last question that we have is, I'm not comfortable with doctors who want patients to use their website from everything from medication renewals and making appointments. How do I address this with my doctor?
Yeah, so interestingly enough, and I think that's a fabulous question, because I think that touches on a couple different items. Is that, number one, I think you should directly talk to your doctor about it. And I think that should be something that you write down ahead of time as one of your issues, is that I can't have a good conversation with you because the platform that you use, I'm not comfortable with utilizing it. And this is a barrier to me being able to communicate. For some people, it may be, it'd be wonderful. They can communicate through there, they can get on there, they're like, this is awesome. It allows, really ease of care and communication back and forth. For others, it could be a significant barrier. So ask them, is there any way that we could communicate, or that I could interact with your office that would be different, that would be more conducive to my overall health? And I don't think that's an unreasonable question to ask. Secondly, oftentimes physicians don't even know the systems in place in their own office as to what needs to happen on that end. Because I can tell you that they are not going through their processes like you, they have never gone through, most likely, the processes that you are going through, from coming in and filling out paperwork and sitting there for your appointment, and the steps that you have to do on the website. I would say probably 95% of the doctors haven't done that from start to finish. So they really don't have a good understanding of what's happening in their practice on that end. All they see is the time period that you're with them and what it truly affects. So their notes, their documentation, their referrals, those kind of things. They don't see all that other things. So never hesitate to talk to a physician about what's going on outside of your visit if that is truly affecting your healthcare. That's crucial. Like, it could be that, hey, I love you as a physician, but you're losing a lot of patients because of your front desk people. They are not very nice. They are not very helpful. And in fact, they're actually hurting people in business. That's a fine question to have if it's true, right? That's a fine question to have and a conversation to have with your doctor. So, and oftentimes that spurs them to go back and say, what are our processes? Why can't we do that? And, and if they start questioning it, oftentimes things will get changed in the office.
Great answer. Thanks, Jill. Well, that's the end of our questions. Jill, I want to thank you for a fabulous presentation. I'm sure we all leave with something that we can do. And, we have another question. I have a PCP who often is not there and utilizes residents. I find this jarring, etc. What do we do about that? That's a great question.
Yeah, so, I think that's, again, like setting your expectations. I think that's, really important. Residents are, some residents are fabulous. They're phenomenal, practitioners. Others, not so much, just like every profession. But to me, I think the most important thing in healthcare is consistency. And so if you're going in every time and you're seeing somebody that maybe is transient through the office, your healthcare is probably not on point as it should be. So even if it's a physician and you're seeing different physicians, now if it's for a cold or something like that and you need to get in and you want to get in today and you can't see your direct provider, that's one thing. But on a consistent basis, I would say that you want to maintain consistency with your practitioners throughout your course of care. And the more you can maintain consistency, the better your prognosis is going to be with your health. So I would really try to stay on point with that. I would set your expectations at the appointment and say, if it is a resident, find one that's fabulous and say, okay, I only want to see this person. Or if they're transitioning through the office quite a bit, say, maybe that office isn't for you, or maybe you can request that you only are scheduled with, a primary care physician or your primary care physician. So, and that's, I do this personally. So my kids go to when they were younger, a pediatrician, and their policy was that they see the doctor and then anything follow up from there, it was a physician assistant or a nurse practitioner. And I said, I came into the appointment and said, I understand that that's how you do things. I said, but I would prefer that when my kids come in, that they stay consistent and they see Dr. So-and-so each time. Is that something that you can accommodate? And they did. And so, if they hadn't, I may have looked somewhere else to go, but I needed to state my expectations to be able to understand, or them to understand where I was, to see if they could accommodate that.
Great, thanks, Jill, that's wonderful. Again, thank you so much for a wonderful presentation. And let's say thanks to everyone who participated. We hope that you found this presentation as useful, I know as I did, and I do a lot of what Jill does as well. And probably by proxy, you are the person that your family goes to find out how to get through the system. It is a quagmire, so you have to know how to get through it. So great essential points, Jill, really appreciate it. If anyone is interested in watching this presentation on demand or recommend that someone else watch this presentation on demand, you can find it by going to www.aarp.org/MI and clicking on that AARP Michigan Virtual Events link. There's a lot of other good things out there too on that link. On the AARP Michigan Virtual Events page, you'll find recent and past presentations so that you can watch on demand, as well as any upcoming presentations that you can register for. Thanks again.